In this segment, we're going to talk about hypofunctioning of the adrenal cortex. And as any other endocrine disorder, we're going to divide it into primary hypofunction and secondary hypofunction. What do you mean by this? Primary, where is the problem? In the adrenal cortex itself. Secondary, where is the problem? Outside the adrenal cortex. Where do you mean? In the pituitary. So let me talk about these two conditions, and let me use my whiteboard. So the adrenal cortex hypofunction. It could be primary, which is an adrenal cortex problem. Or it could be secondary, which is a pituitary problem. Let's talk about the difference. The major cause of primary hypofunctioning of the adrenal cortex is the disease known as Addison's disease. Addison's disease is an autoimmune destruction of the adrenal cortex. Autoimmune destruction of the adrenal cortex. All three layers are destroyed. So aldosterone goes down, cortisol goes down, androgens go down. So what are the symptoms? What are the symptoms? When aldosterone goes down, normally, what's the function of aldosterone? Save sodium, P, potassium, and hydrogen. When you don't have aldosterone, you will not save sodium. So you're going to develop hyponatremia. So when you lose sodium, you lose volume. So you're going to get hypovolemia. And when you lose volume, your blood pressure goes down. So you get hypotension. And when you lose aldosterone, you don't P potassium. So your potassium will go up, hyperkalemia. So here, the lack of aldosterone leads to low sodium, high potassium, and you don't P acid, you don't P hydrogen. So hydrogen accumulates in your blood, so that's acidosis. What type of acidosis is that? It's non-anion gap metabolic acidosis, if you remember. When cortisol goes down, you will not be coping with stress. Not coping with stress. And please don't underestimate the impact of this. If you don't have cortisol, literally, you will not be able to get out of your bed every morning and go to work. If you don't have enough cortisol, you will not be able to wake up and get out of your bed and go to your work. Lack of cortisol will completely paralyze you. Not paralyze as in neurologic disorder, but will completely, you will not have energy to do anything, to cope with stress. And what's the most common cause of stress? Infection. So even a common cold will be like the worst infection for you, not because you are immune compromised, but because you're not equipped now to cope with the stress of this infection because your cortisol is low. Androgens low will lead to loss of libido. Now, what stimulates cortisol? It is the ACTH. So by feedback mechanism, when cortisol is low, what happens to ACTH? ACTH in Addison's disease, ACTH will be increased, elevated. When ACTH comes out of the pituitary, what comes out with it? MSH. So the MSH, melanin stimulating hormone, will also be elevated. In Addison's disease, the melanin stimulating hormone is elevated. As a result of that, these patients have hyperpigmentation. And you can spot diagnose patients with Addison's disease with this hyperpigmentation. And they have very nice, very attractive body tan. Wow, what a nice body tan. Have you just come from Florida? No, I have just come from my endocrinologist. I have Addison's disease and I have this hyperpigmentation. By the way, Kennedy had, the ex-American president had Addison's, and luckily enough, they have just invented steroid therapy for Addison just 1 year before he was diagnosed with Addison, and he was adequately treated. The treatment here will be give them corticosteroids, Okay, so this is primary hypofunction of the adrenal cortex. What if the problem is in the pituitary? What if there is something compressing the pituitary, preventing the pituitary from producing ACTH? So the major difference between primary and secondary hypofunction of the adrenal cortex is the ACTH. It is elevated in Addison's disease. It is elevated in primary hypoadrenal cortex function, and it is low in secondary hypofunction of the adrenal cortex. When ACTH is low, is there any effect will show on aldosterone? And the answer is never. So aldosterone is not affected. Aldosterone is not affected. When your ACTH is 0, your aldosterone will be secreted as usual because aldosterone is not stimulated by ACTH. So you, in secondary hypofunction of the adrenal cortex, you do not have low aldosterone. You have normal aldosterone and you have normal mineralocorticoid activity. But what happens to cortisol? It goes down. So you will not be able to cope with stress. What happens to androgens? Will go down and you will have loss of libido. What happens to MSH? It's not elevated. Not elevated. And therefore, there is no hyperpigmentation. And this is the major difference between primary and secondary hypofunction of the adrenal cortex. Let me get back to the PowerPoint before we shift to the hyperfunction of the adrenal cortex. So the primary hypofunctioning of the adrenal gland, adrenal cortex, known as Addison's disease, it's an autoimmune destruction of the adrenal cortical cells. The ACTH is elevated, and this leads to elevated MSH, and this causes hyperpigmentation. and aldosterone is low, whereas in secondary hypercortisolism or secondary hypofunction of the adrenal cortex, the problem starts by low ACTH, and this low ACTH will not result in hyperpigmentation, and aldosterone is not affected. But in both of them, you will have low cortisol effects and low adrenal androgen effects in both of them. So you will not be able to cope with any stress. Okay, in the next segment, we're going to talk about the hyperfunction of the adrenal cortex.